Knee replacement surgery is one of the most successful and effective treatments for people with joint pain and stiffness in the knee arising from arthritis or other forms of knee joint damage. It can be a daunting procedure to consider, so it can be comforting to better understand everything that's involved in having a knee replacement before embarking on this journey. In this video, I'll quickly talk you through the anatomy of the knee and explain what to expect before, during, and after your knee replacement surgery. I'll also answer some of the most common questions I'm asked during a consultation and give you a timeline of how long it takes to recover from your knee replacement. So, let's get started. I'm Mr. Sherif El-Tawil, specialist knee consultant surgeon at the Clementine Churchill Hospital in London, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. First up, it's important to mention that you don't always need surgery to relieve chronic knee pain. Sometimes joint pain can be managed with medication, weight loss, physiotherapy, or various injections. These injections can include hyaluronic acid, which acts as a nourishing lubricant, steroids to reduce inflammation, or even PRP, which stands for platelet-rich plasma, which in essence comes from your own blood. You may have already tried some of these. If these sorts of treatments don't give enough relief over time, then you might find yourself considering a partial or a total knee replacement, depending on your condition. Knee replacement surgery is a very successful and common procedure as it quite literally replaces the damaged joint. So let's take a look at a healthy knee joint so we can get to grips with what can go wrong in arthritis and how we can rectify the issue through replacement surgery. So the knee joint is formed where the femur, the thigh bone, comes to meet the tibia, the shin bone. And the ends of both of these bones are coated with a very smooth articular cartilage, which we simply cannot bring back if it erodes away, as is the case in arthritis. And I say this cartilage is worth its weight in gold, because the only thing we can do is literally replace it with metal. So a replacement involves replacing this side with metal, this side with metal, and putting a plastic insert in between the two metal surfaces, again to allow gliding and smooth movement of the knee joint as we bend and as we extend the knee. I like to talk of the knee as actually being made up of three smaller joints. We have the inner aspect, which is the medial side, the outer aspect, which is the lateral side, and the front, where the kneecap is, and we call this the patellofemoral side. Some patients have a pattern of disease where only one of those three compartments is affected. And if this is the case, then only that part needs to be replaced. The advantage is recovery can be faster, the overall satisfaction is greater, and there is a better feeling to the knee. A lot of my patients are back skiing and playing tennis with a partial knee replacement, which may not be possible if the whole joint was replaced. The possible downside, however, is that if there is deterioration in other parts of the joint, then conversion to a total knee replacement may be necessary in the future. But this is not so difficult to perform if required. If you're in the process of considering surgery, do remember that talking to a surgeon about knee replacement treatment doesn't mean you're committing to surgery. It's simply a chance to understand the various options available to you to help you make the best decision in your particular situation. Surgery should always be the last resort, and we would suggest non-operative options first if these have not already been tried. You are always in control of what happens and the path that you choose to take. I believe our role is to give you the options customized to your individual's diagnosis and your personal circumstances, and equip you with enough knowledge to help you make a decision. If you've decided to have a knee replacement, the best thing you can do to prepare is get your knee as strong as possible through exercise and physiotherapy. Strong muscles mean you will recover faster after your surgery. Patients often ask how this can be done with a painful knee, and the answer is simple: through non-weight-bearing exercises such as swimming and cycling. Taking painkillers an hour or so before the exercise will also help. Losing any extra weight will also pay dividends, both in reducing the risk of complications of surgery and also speeding up your recovery. If you have arthritis and you're looking for some effective physiotherapy exercises to help with strength, mobility, and pain relief, we have videos on our channel where our physiotherapists talk all things arthritis and about recovery from surgery. I'd recommend you make arrangements ahead of time for a friend or family member to bring you to and from hospital. If not for the company and moral support, then for the taxi service, as you won't be able to drive for 6 weeks. It's also helpful to think through all the ways to make your home as recovery friendly as possible. Stock up on things like easy to cook food and essentials, and remove that old rug with curled edges to avoid tripping. All the details around pre-surgery preparation that are unique to you will be explained in detail to you during your consultation and planning process. You won't feel any pain at all during your procedure, as you will receive an anesthetic. This can either be a spinal anesthetic or a general anesthetic. We generally encourage a spinal anesthetic, as you are likely to recover better following it. But the final decision will be between you and the anaesthetist, who will see you on the day of surgery. It is important to note that with a spinal anesthetic, you can still be fully asleep with sedation, and you will not be aware of the surgery. Not all patients, however, can receive a spinal anesthetic, but if it is possible, I'd certainly recommend it for longer lasting pain relief and faster mobilization after surgery. We also inject lots of local anesthetic in and around the joint itself to ease the pain. Many patients are surprised immediately after surgery how little pain there is, but this is because of the spinal and local anesthetics used. I call this the honeymoon period, and soon the expected pain will set in. But don't worry, we will have you on strong painkillers to counteract this and make sure you're as comfortable as possible. It is important not to fear pain. It is not a sign of harm, and challenging this mentally will help you see it merely as an obstacle that can be overcome. Fight through it and your recovery will be faster. Once you've been anesthetized, we make an incision at the front of the knee and then begin the process of removing the worn parts of the knee joint. We use trial implants to check everything is perfect in terms of size and positioning before cementing into place the real implant. If you're having a partial knee replacement, only the failed part of the knee will be replaced, leaving the rest undisturbed. We are also lucky to have the Navio robot on hand, which can be used routinely to aid in surgery, especially in more complex cases. Don't worry, we surgeons are still in control and simply use the robot as an aid to accurately position and balance the knee. Modern, minimally invasive techniques are used to reduce trauma and aid a swift return to activity. Once we're happy, we'll close the incision using dissolvable stitches and then glue to ensure a perfect seal. A dressing and bandage will then be applied. The whole operation typically takes about an hour and a half, and after surgery you'll be taken to the recovery room to be monitored by our team of specialist recovery nurses. Then once our team are confident everything has gone well, you'll be transferred to your private bedroom to start your recovery in comfort. I'm often asked, how long will my knee hurt for after surgery? And how long will it take to recover from a knee replacement? Yes, it's true, knee replacement can be a painful procedure, but we are in this together. The anaesthetist will have you prescribed on strong painkillers to keep you as comfortable as possible. And local anesthetic within the knee will also help control it. We also use the latest enhanced recovery techniques to speed up your recovery. But recovery from knee replacement also requires your commitment and dedication to make your knee recover as best as possible. The more effort you put in with your exercises, the faster your pain and stiffness will actually improve, and the better the final outcome. We will start your rehabilitation straight away on the day of surgery, and you'll be up and walking with the physiotherapy and nursing staff. The reality is that the first few days are challenging, but every day that passes, things get better. Immediately following your surgery, pain and swelling around your knee joint is absolutely normal and should not alarm you. Intermittently throughout the day, we will wrap your knee in a specialized cooling device to help the pain and swelling, to allow you to mobilize as soon as possible. It's also important to keep the leg elevated when possible to help reduce the swelling. Initially, normal levels of pain can sometimes be quite significant, but it will be different from the chronic joint pain you're experiencing before your surgery. Again, it is important to know the pain is expected and not harmful. Don't let it stop you mobilizing, otherwise your recovery will be slower. We will have you on sufficient painkillers to make you comfortable, so please don't worry, the team will take good care of you. The first couple of weeks at home are particularly difficult, but you'll be walking independently with crutches. Walking will gradually become easier up to the 6-week mark when things start to dramatically feel better. After coming back to see me at this point, we'll look at whether your knee is strong enough for you to safely drive or go back to work. If you're interested in a more detailed recovery timeline, we have another video on what to expect in the weeks, months and up to the full year following your surgery, where we'll look at what point you'll be back relatively pain-free and say gardening if that's what your goals are. So that was a brief run-through of what to expect with a partial or total knee replacement. If you want to come and see me for a consultation to talk through your options for your knee pain, or indeed discuss any knee problem, you can book online via the link in the description below, or alternatively search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below this video as we'd love to hear from you. Otherwise, thanks for watching.